What is the difference between generalized and secondary generalized seizures? Imagine your brain as a busy city with many neighborhoods. Seizures happen when there's a sudden electrical storm in the brain. Now, some storms start in one neighborhood and then spread across the city, while others hit the whole city at once. That's the key to understanding the difference between generalized and secondary generalized seizures. Generalized seizures are like a citywide blackout from the start. They involve both sides of the brain at the same time. These seizures often cause loss of consciousness and can include different types like tonic-clonic seizures, which used to be called grand mal. During a tonic-clonic seizure, a person might fall, stiffen, and then have rhythmic jerking movements all over their body. Other types include absent seizures, sometimes called petit mal, where the person might stare blankly for a few seconds, or myoclonic seizures, which cause quick muscle jerks. These seizures happen suddenly and involve the entire brain from the very beginning. Secondary generalized seizures are a bit different. They start in one small part of the brain, like a neighborhood, with focal symptoms such as strange sensations, twitching, or confusion. These are called focal seizures. But then, the electrical activity spreads from that one area to both sides of the brain, turning into a full-blown generalized seizure. This spreading process is called secondary generalization. For example, someone might feel a strange tingling in one arm or experience a brief stare, and then suddenly lose consciousness and have convulsions as the seizure spreads. The main difference is where the seizure begins. Generalized seizures start across both sides of the brain at once, while secondary generalized seizures start in one part and then spread. This distinction is important because it helps doctors figure out the best treatment and understand the underlying cause. For people with epilepsy, recognizing whether a seizure is generalized from the start or becomes generalized after beginning as a focal seizure can help in describing the event accurately to healthcare providers. Both types of seizures are serious and need medical attention, especially if they last longer than 5 minutes, happen repeatedly, or if the person does not wake up afterward. It's always best to see a healthcare professional for proper diagnosis and management. Treatments are available that can help control seizures and improve quality of life. Remember, every person's experience with epilepsy is different, so personalized care is essential. Understanding whether a seizure is generalized from the beginning or spreads from a focal point helps in tailoring the right approach for each individual.